Welcome back to Pharmacy News. Joining me now is Renee Baines from Partners in Recovery. Thanks for your time, Renee.
No problem.
Tell me, what exactly is Partners in Recovery?
So Partners in Recovery is a federally funded initiative that aims to improve the system's response for people living with severe and persistent mental illness. So I guess if you break that down, what it looks like is we work alongside people who've experienced a lot of difficulty in accessing the right supports and ensuring that those supports and services are working well together. And a facilitator from Partners in Recovery will work with that person to identify the linkages, try and increase access to make those connections,
Sure.
and ensure that that stakeholder group, including that person at the very centre, are all working effectively.
So what sort of supports are you talking about?
It can range from anything around mental health specific support, that could be clinical or non-clinical, to housing, to trying to navigate disability services or Centrelink or any number of things really, yeah.
So there must be so many benefits in terms of that community support as well.
Yeah, I guess what we work under the premise is that we are all in this together.
Yes.
And in order for the sector to benefit, we need to leverage the strengths of what each service can offer and really refine the way that that's integrated and that works to benefit the individuals that we work with.
So what role would pharmacy play?
Pharmacy play quite an integral role. So what we have seen and the feedback that we have from people that have accessed the service who do utilise community pharmacies is that the education that they can provide around particular medications has been really beneficial. Having someone that doesn't play, I guess, so much of a formal role, but
Yes.
they can touch base with, who doesn't have to report back, who doesn't, need to do all of that. They can build some rapport and they can drop in and go, I've got a question about this, or maybe there's some mental health issues as well as physical health, and I'm taking 10 different types of medication.
Sure.
Can someone break that down and help me
Yes.
understand what impacts that could have on me, and how to best manage that?
Absolutely.
So they're, I guess, some of the key roles, as well as providing really good referrals. Some of the work that we've done with pharmacies has been around building their capacity to understand what services are available in the community, I guess more in relation to mental health, and the referral pathways to access that. So we have had some pharmacies refer through to not only Partners in Recovery, but also some general mental health supports. And the feedback around that's been quite positive.
Wonderful. So
Yeah.
moving forward, how do you see Partners in Recovery, or where would you like to see Partners in Recovery?
So as it stands, we're being refunded, and that whilst that will take a little bit of a different shape, the main focus for us is around building the capacity across the services to work well together.
Yes.
So we call that around systems integration and service collaboration. So it's about refining the partnerships, really looking at where's the expertise sit and how do we work in with that, tap into that so that the people in the community are getting the best supports that they can.
Absolutely.
Yeah.
Renee, thank you so much for your time.
No problem, thanks.
Renee Baines from Partners in Recovery, and we'll be back shortly with more from Pharmacy News.